If you are a frequent mouth breather or even a chronic mouth breather, or you work with people who are chronic mouth breathers, then switching to nasal breathing is going to give that instant benefit on all aspects of life. And the only thing you really need to do is shut your mouth as often as you can. In general, you can say that nasal breathing is superior to mouth breathing, especially at rest, especially in your day-to-day, when you're chilling on the sofa, when you're, driving your car, when you're laying in bed, especially, and even during certain levels of exercise. And the first one is the function of filtration. So it is a filter. Now, air is composed of nitrogen and of oxygen and a little bit of carbon dioxide and some other, air gases, but it is also, of course, filled with many things that are just floating around in the air. So there's many pollutants, many microbes, lots of stuff that you don't want in your face and you don't want in your lungs. So the nose is a tremendous filter, and what you can see over here is that there's a system for that. So it's an air conditioner, which, like I said before, there's an optimal temperature for air to come into your lungs, and your nostrils already help with that. And then also the entire inside of your nose, including the sinuses, help with making sure that the air is at the right temperature. Imagine a very cold winter day and you step outside, you take a big breath, and it's almost like your lungs are freezing on the inside if you take that breath through your mouth, of course. Or you take it in through your nose, and your nose gets super cold on the inside. You go, ooh, that's bad. Well, it's better to have it in your nose than in your lungs because your lungs don't have that protection. So now you have filtration, optimal temperature, and optimal air humidity, so the amount of water that is in the air that can come into your lungs so that your lungs can optimally use this beautiful air that you've breathed in and take out the oxygen. If you, for example, don't have this filtering function and you breathe in through your mouth and all of this crap actually comes into your lungs, then you risk, of course, damaging your lungs over long term, but it can also create inflammation within the lungs. Chronic mouth breathing is the cause of many, many issues.